I'm Colby Ward. I'm an orthopedic surgeon at McLaren Northern Michigan. So I swam for Michigan State in college, and while there I had a shoulder injury, and I was treated by the orthopedic sports surgeons at Michigan State. It was a great group of guys. While being treated with them, I just thought that this was the coolest job ever, and that's really what piqued my interest in it. I hadn't really thought of it before, but because of my injury, I found myself going to med school, then going into orthopedic surgery. I did my residency here in Michigan, Henry Ford, and then I specialized, did my fellowship in Minneapolis, Minnesota, trauma primarily, but also half of my week was spent doing advanced revision arthroplasty, where people that had previous, whether it's hip replacement or knee replacement, they needed a revision of that for whatever reason, whether they broke or the component was wearing out. That was our job, was to go in and revise that component. We did a handful of primary arthroplasty procedures as well too. One of the things I think I can bring to Northern Michigan is my experience in trauma in the arthroplasty setting. A large portion of my training was spent revising arthroplasty components which had either worn out or patients had sustained a trauma and fractured around it. So that's really what I think I can help bring up to the Northern Michigan setting, is that experience in advanced arthroplasty and trauma. I grew up in the Detroit area, so I've been in Michigan my whole life. Part of my family lives in Northern Michigan in the Gaylord and Charlevoix region, and so I've been coming up north my whole life. I love it up here. One of the things that's really drawn me to wanting to live up in Northern Michigan is the water. I am in love with the water. I want to live on the water, and if I could spend every minute of the day on the water, I would. Boating, swimming, water sports, or just watching my dogs play in the water. My ultimate goal for every patient that I see, whether it's non-operative treatment in clinic or it's an emergent procedure in the OR, is to get that patient back to their functional status before their injury or better.